The first session that we'll have coming up is going to be Kathleen Murphy and I discussing the barriers and facilitators to research uptake in the business community, focus group findings. After that, we'll have best practices in employee retention and return to work, lessons learned from employers, and that will be done by Rebecca Salon and Brittany Taylor from the LEAD Center. From 3:40 to 3:50 will be a short break. When we come back from that break, we'll have a panel discussion facilitated by Kathleen Murphy with our panelists Mark Williams from the USBLN, Arun Karpoor from Cornell Employment and Disability Institute, and Ann Miano from Microsoft. And to conclude, from 4 o'clock to 4:50, we'll have a takeaway message from Kathleen Murphy to finish up our conference. All right, and for right now, we'll hand it off to Kathleen Murphy.
Well, good afternoon, everybody. Thanks for joining us or for sticking with us. I'm going to be presenting on some of the KTER Center research, and we've entitled our presentation, Barriers and Facilitators to Research Uptake in the Business Community, Focus Group Findings. And both Stephen Boydston and I will be presenting. I'm the KTER Center Research Director, and he works for the KTER Center as a research assistant. For those of you who weren't here yesterday at the policymaker session, I will review briefly some of the information that was conveyed there about the KTER Center's research goals. The priorities to which we responded to from the National Institute on Disability and Rehabilitation Research tasked us with 3 research goals. One was to identify evidence from the literature in selected specific employment topic areas for persons with disabilities. A second was to describe factors that impede or facilitate the use of employment research, and then to test effectiveness of KT strategies that promote research use, namely the findings from the R1 activity. So the guiding questions associated with those tasks and the way that we responded to them to figure out what is the evidence. We were tasked to do systematic reviews and research syntheses, to explore barriers and facilitators to the use of the evidence that we might identify. We had to figure out what specific barriers and facilitators might be among the 4 mandated KTER Center project audiences, which are VR professionals, people with disabilities, policymakers, and business people, which not coincidentally correspond to the sessions of this State of the Science Conference. And to test the strategies to promote use of KTER Center's systematic review findings. For those of you who were here earlier, you heard about one of those, which is looking at the use of Facebook among traumatic brain injury survivors and whether or not that will help them with return to work using findings from the systematic review that our partners at VCU did on that topic. So the activities here, I won't spend too much time on this slide, but we've done a couple of systematic reviews, the one on return to work for TBI, and we did one on employment interventions that promote the employment outcomes for cancer survivors to figure out barriers and facilitators to research among VR professionals. We did an online survey of state agencies in 6 states. We interviewed policymakers and conducted focus groups, 13 of them among members of the business community and 6 with people with disabilities. So the presentation that Stephen and I are going to give today talks about what we learned from the focus groups among members of the business community. Those focus groups were held mostly in the fall of 2011 with a couple of extras in September 2012. They comprised 51 participants, and many of them were from the disability-oriented U.S. Business Leadership Network, various chapters, and in the panel after this presentation in the LEAD Center will have a USBLN representative, Mark Williams, among us. The recruitment and facilitation was conducted by Valerie Brooke and Katie Inge and Carolyn Graham of KTER Center's partner, Virginia Commonwealth University, and you have virtually met some of them during this conference. We used a semi-structured instrument so that there could be a conversation going on and open-ended questions, so there was variation and elaboration in the conversations. The focus groups were pretty diverse as far as demographics, although it was 70% women. Both the median and mean age of our participants were 50 years old, though they ranged from 26 to 73. And this is reflecting that it is a business leadership network. So people were, to be an employer, you have to have advanced a bit in your career so that people had something meaningful to say about the topic. We were 70% white and 70% had a college degree. One variable that we tried to look at particularly carefully is employer size. So it was pretty evenly divided between the small, medium, and large. We had 22 small, and by this, obviously, probably anybody who's interested in this topic knows that it can be complicated how to define what a small business is, but for our purposes, we used their self-report on their number of employees. So 20 of our participants were from businesses that had less than 50 employees, and 22 were from companies that had more than 200, but some of them were from very large international companies with several thousand employees, and then there were a few medium companies with, I guess, 9 there, who had employees between 51 and 200. So what we did with these audio tapes is we had them transcribed verbatim, and both teams went through and just read them and did a basic content analysis to come up with an initial taxonomy of codes, kind of topical tags. Stephen and I coded transcripts from all 3 of the data sets. So from all the narrative data that we had from the interviews with policymakers and the focus groups with the business and with the people with disabilities to refine the framework so that we were taking into account the different ways that the concepts were used across those 3 audiences. And then we independently, Stephen and I would go off in our little separate offices and code a few transcripts at a time, meeting periodically to make sure that there was no interpretive drift, that he wasn't all of a sudden starting to think about a particular concept in a way different from me. We entered the data into the qualitative analysis software and Vivo, and as I mentioned, the goal as outlined in the priority was for us to figure out, well, what are the barriers and facilitators to the use of research, in this case among the business community, in order that we could select an appropriate KT strategy to convey information about cancer and employment as identified in our systematic review to members of the business community. Okay, Stephen is going to take over now and describe some of what we learned from these interviews.
Thank you, Kathleen. Next, I'm just going to go over a few of the quotes that we pulled out from some of these transcripts, specifically for this slide, answering sort of how do you define research. One of the themes that we saw during these focus groups was that many of the participants would define research with a big R versus a small r differently, or separate from each other, similar to primary or secondary research. One of our participants also said, quote, "I always think there's a little p policy and a big P policy." So it's sort of distinguishing between the 2 types of research that we have there. Second, we have the review of descriptive data, such as demographic data sets, especially from federal sources. So they define research just in terms of statistics many times. There was a collection and summary of their own client or consumer data, for example, TV ratings. And many times we saw this was an example of what was important to that specific individual's organization or business in terms of making their day-to-day lives easier and so on. That's how they would define research. Next, we're going to look at sort of a similar point but slightly different, is defining evidence or evidence-based practices and what our focus groups responded to when asked how to define those. One of the most interesting things for me was looking at when asking them, is evidence-based or evidence-based practices synonymous with best practices? During one focus group, we had respondents say, "I've often thought of it as best practices. The evidence shows that those are the best practices to use," end quote. However, the response to that from a different participant was, "There's nothing scientific in that kind of terminology. If I had to say evidence-based practice and best practices, are they synonymous? I would say no, and maybe they shouldn't be used synonymously." So I think a lot of people disagree or cannot always come up with a perfect definition for those terms, but it's very interesting to see how they're used. Specifically, a lot of terms that were used were tested, proven, measurable, effective, and successful. And I think in general, most people say that their organizations value the term or the idea of evidence-based practices, but it's not always clear what referent they were using and in terms of what is evidence-based. One of the other definitions that I saw that was very interesting was slightly cyclical in nature. So when the participant was asked what are evidence-based practices or best practices, they responded, "I consider evidence-based practice to be those that are substantiated through research and proven successful for the best practice." So many times it's kind of a loop that they go through in defining these terms. So next we'll look at how employers specifically have used research or reported using research during these focus groups. The first one is to use to promote or support an approach to service. So, quote, "We assess current and past research and other guidelines and resources along with relevant literature to give us the best high-quality care to both our patients and our employees," end quote. And that was for a more example of a medical setting. The second one we have is here to document that a product is effective. So clinical studies have been done of how beneficial our product is to a person's health. To analyze potential demand for a product or service. Quote, "A lot of the research we have focused on is about the market itself to prove our reason for focusing on disabled consumers." So, and a lot of times employers define research in the idea of market research. And finally, to select vendors or to benchmark industry standards, especially in relation to salaries. One other way that we would like to highlight that employers have used research is to comply with a specific mandate, and we have two quotes here specifically for that. Sometimes it's not related to profitability, but it's a mandate, and you're trying to figure out how to comply with it. And that was in relation to the business person building a hydropower station and the mandates that are the things that are required in doing that. And the second one is an employer researches how to handle an applicant that comes and has a disability. Maybe when they research how to handle that, they come across the ADA legislation or the something to do with a legal mandate. So compliance with the legal issues was also something that the employers used research for, at least within their definition. We also noticed in these focus groups that the larger companies seem to use research more, and that's just self-reported. So they used research more to advocate to internal audiences as well as customers. There's a few quotes there regarding to that. So the first one is, every time we need to get to every time we need to present a recommendation on whatever it is, you're going to have the data to support it. So sort of as a ancillary support of your work. Second point that we have on the slide is we have a number of countries outside of the U.S. that are not as inclined to hire people with disabilities. One of the things I've done is provided the research to reinforce, obviously, a productive hire can come from a source of disabled candidates. Some of the success stories have come from the research. So pointing out that it's not just in the United States that we have examples of this, and that we can pull some success stories from what they're calling their idea of the research that they're using. So why do larger companies research more? One of our focus group participants said that they have found that in larger organizations they've worked in, they're typically bigger, very costly decisions that are made and that impact a larger number of people. So they have to have a more regulatory environment to deal with these risks and manage these risks. So because of the factors, the validity of the data and who is signing off on the decisions that are so based on the data are very mission critical to them, so it does get more formal. So the more important the decision, the more people the decision will impact, the more important research can be. So how is research used in relation to people with disabilities? The business community reported that they use it to learn about how to accommodate a particular population. For example, we heard about veterans with post-traumatic stress disorder, post-traumatic stress syndrome. To research a selection of particular assistive technologies and understanding what's available or how to use what is available. To learn about how to make web-based products accessible, including those used for hiring, and to select an approach to training employees. And the quote was there is, "We use research to develop our competency models." Finally, one last slide from me in terms of research and use in relation to hiring people with disabilities. Many of our participants mentioned the Burton Blatt study that found a $500 average cost for accommodations and awareness of other reasons to hire people with disabilities. For example, I think research shows that everyone becomes more productive in the type of environment, and I can't tell you why, but disabled employees seem to have a positive effect on their non-disabled coworkers. One thing that we noticed is our audience in this study may not have necessarily been aware that this research is frequently updated. And Kathleen will come back and discuss a few of the barriers and continue from there.
So, you know, as I mentioned, we were trying to figure out, well, you know, what are the barriers to that people in these focus groups are expressing related to the use of research. So people often talk about time. So, you know, we can have a code that says, well, this has to do with time, but we need to think through what do they really mean. In some cases, it means that the findings are timely, right? They need the findings in time, and there's concern that, you know, by the time you, meaning you, the researcher, do that research, we may have gone on to the next project. I think everybody online and logged in can relate to the idea of time being fragmented, that we have so many things to do, everybody's multitasking, so there isn't a lot of time to have that focused look at that absorbing research may need. You don't have a lot of time for research, a lot of reading and sifting through things, you're just moving all of the time. And there's the old adage, time is money. And some perceive that, you know, even if their time wasn't fragmented and they had timely findings, that their customers just wouldn't value the research-based nature of the product, so it's not a good investment of time. Next slide. Another kind of barrier is that other kinds of information are more important. So as an example, some people said, well, some of it is gut when I hire people. Obviously the criteria, the prerequisites have to be there, but there has to be chemistry, and gee, all the research in the world isn't going to help that. Or just people value more boots on the ground stuff than looking to research, maybe because there isn't research on that topic yet. So that doesn't mean, though, that employers aren't consuming research, and they are, and it's just they may mean different things, as Stephen explained when you ask them, do you use research? There's definitely a preference for data generated by in-house or highly trusted external sources. This is consistent with what KTER was talking about in the previous session, that people with disabilities, when they were looking for research, wanted to talk to their who they considered to be a trustworthy source, someone with whom they already had a relationship. So, or in this case, it isn't necessarily a prior relationship, but someone that they consider to be a subject matter specialist, they would reach out to, and it wouldn't be written research, it would be verbal, that they want, people in business are busy, they just want to get the gist of it over the phone, maybe. So there's high value for information channeled through professional networks, whether it be face-to-face, over the phone, or also people talked a lot about they're fine with being on a listserv, getting the email, and, you know, having the executive summary and briefly looking, and whether or not they'll go further with it is up to how relevant and timely and all the other things we've been talking about the particular product is. Next. So there is just in general, you know, a lot of interest in social media in our society. So we thought, well, is social media a good tool to use? There's a lot of assumptions sometimes that not every project now must not only have a website, but also have your Facebook page and your Twitter account. So we wanted to ask the people in our focus groups if this is where they would go to find information about research. So businesses obviously are using Facebook and YouTube, but it's primarily to market. They are pushing out information, and these tools are not generally perceived as a way of finding research-based information, perhaps because of their use of marketing, of using them as marketing tools, but although nobody said that. So there is some use of social media, but similar to what KTER was talking about with the individuals with disabilities, that's more at the individualized than at the organizational level. One person did mention Twitter. He or she thought it was a good way to publicize announcements, press releases, or snippets of information. So again, this is pushing out information, not consuming it. And 3 people did mention Twitter, though, as a source of research-based information. However, I thought it was interesting that all of them mentioned they were from government or nonprofit employers, not private industry. Now, LinkedIn is an exception. It's the social media tool most often used as a source of research-based information, even if it wasn't the first go-to. It's seen as a way to get an overview of a topic. One person said, well, I use it to get different perspectives when I'm doing my research, make sure I'm covering things I probably didn't think of as an individual. It's just more like a fishing trip. So this is more really at the brainstorming level of research. Getting different trends, seeing where the market is, and how people are reacting to that. So some final thoughts, getting back to, well, we had to pick a KT strategy, and to address the time barrier, there is an expressed advantage for online information in the sense that it is available 24/7. So some business people might do this kind of activity if they're going to do it at all in the evenings, and maybe they would hop on a webinar and be more likely to do it then or early in the morning rather than right in the middle of the day when they are tend to be offered. And especially for the larger companies that Stephen described, quantitative information relevant to the business case or to compliance is a prerequisite for being interested or being used. But once you, researcher, have that in mind, have that in hand, keep in mind that it does help, given the expressed preference for verbal interaction and for those conversations with the subject matter experts, to build into the dissemination these elements of human interaction that, ironically, social media can allow for. You can upload voices, like we are now, images, there's opportunities for dialogue in the comment fields, so that this is a way to embody communication and literally to flesh out findings. And that stories and case studies often offer a way to connect findings to empirical experience for those people who just, need that gut reaction. And just the only other thing I'd say, so that is why, as far as our own choice of strategy, of a KT strategy to test, we did use a webinar to try to do our outreach to employers, and we're in the process of conducting that study. But we included in the test, we have half of our webinar participants getting an additional offer of technical assistance so that they can both have the experience of the didactic information sharing combined with the one-on-one interaction, verbal, where they can ask questions about how to apply that knowledge in the workplace. Thank you very much. So we are now going to so we're going to go turn now to the Lead Center presentation with Rebecca Salon and Brittany Taylor. Are you all with us?
We are. Thank you.
Okay, great. So I'm just going to say a few words about each of you, and then I'll let you start.
Great.
So Rebecca Salon, we're delighted to have her. She is Project Director for the Lead Center at the National Disability Institute. She's a leader in policy and program development with an emphasis on demonstrations that promote employment and economic self-sufficiency for individuals with significant disabilities. Dr. Ceylon also works at the District of Columbia's Department on Disability Services, where she is lead for the DC's Employment First program initiatives. Also presenting today from the Lead Center is Brittany Taylor. She has several years of experience in nonprofit program management and in coordinating efforts for systems change in the areas of employment, education and training, and workforce development at the national level. Currently, she is program coordinator for the Lead Center at the National Disability Institute. In this capacity, she advances employment outcomes and economic self-sufficiency for individuals with disabilities through designing tracking and reporting systems for project deliverables. She also facilitates research and demonstration projects and organizes communication and timelines for federal grant activities. So I'll leave it to you, Rebecca and Brittany.
Thank you so much. This is Rebecca. We're very happy to be included in today's presentation. We'll be talking about best practices in employee retention and return to work. And we'll be highlighting some of the lessons that we've learned from our work with employers. For those of you who are new to the LEAD Center, we are the National Center on Leadership for the Employment and Economic Advancement of People with Disabilities. We're a collaborative of disability, workforce, and economic empowerment organizations led by the National Disability Institute with funding from the U.S. Department of Labor's Office of Disability Employment Policy, or ODEP. Our mission is to advance sustainable, individual, and systems-level change that results in improved competitive, integrated employment, and economic self-sufficiency outcomes for individuals across the spectrum of disability. So the LEAD Center started in October of 2012, so we're almost through our second year. We have three primary areas of focus. One is employment, one is economic advancement, and the other is public policy and leadership. And we work in collaboration with a number of national partners and subject matter experts, as well as quite a few dissemination partners. We'll talk a little later about our Knowledge Translation Consortium, but that also was started last year. And I won't go through them, but we've listed as part of the materials our national partners. And we're happy that Mark Williams is part of this initiative today, as USBLN has been an important partner, and we're actually going to be talking about a study that we did with them last year. And we've also listed our dissemination partners, and those are available on our website as well. So we wanted to talk about some of the research that we've done that's relevant to this topic. I just mentioned that there was a study done with the USBLN on employer best practices in working with mature workers and workforce flexibility. And we'll talk a little about that in a moment to give you some specifics about it. We'll talk also about a report that is about to be posted on our website on best practices in employee retention and return to work. And that was an in-depth look inside a single exemplary American corporation that we selected because of their excellent retention numbers and low turnover, and because they represented, both urban and rural and suburban sites. They're a multi-site corporation, and we got to really look at what they were doing that promoted their retention and return to work. We have conducted pilots that promote customized employment as a universal design and retention strategy, and we'll talk about that a little bit as well. And finally, we've partnered with the Families and Work Institute on their upcoming national study of the changing workforce, so that this coming year, and they're starting it now, will include questions about the experiences of people with disabilities in the workplace. They also have just released their 2014 National Study of Employers, which we've provided a link for here as part of the presentation. So when might businesses use currently available research to make decisions? Turnover is extremely costly for businesses, as we all know, with respect to money, time, and productivity. So for retention and return to work strategies that enable people to resume work or stay at work, that would be an important focus for employers so that they can return to work in some capacity as quickly as possible, thereby reducing workers' compensation costs, maintaining productivity, maintaining connections between the employee, supervisor, and their workplace, and reducing turnover and thereby retaining talent. So it's an important area for us to have studied. And I'm going to turn it over to Brittany to talk some about the USBLN survey.
Great. So thanks, Rebecca. So to give you a bit of context, I know we have Mark Williams on the line. USBLN is a national nonprofit organization. They were founded in 2002, and they help businesses drive performance by leveraging disability inclusion in the workplace, in the supply chain, and in marketplaces. Last year, we conducted a survey of the USBLN members, and they represent a fairly broad range of company sizes and a variety of industries. On their workplace flexibility practices, particularly on some of the practices in relationship to mature workers. And all of the survey respondents, again, were USBLN members, and 20% of them, or 20% or more of their workforce, they identified as mature workers. And in the survey, we found, and that's an interesting way the headings went up, that's okay. We found that overall, the workplace flexibility was used as a retention strategy, and it was really valued and integrated into the company culture of the respondents. 2/3 of the respondents reported taking actions, policies, and practices in workplace flexibility to become more age-friendly and or to provide workplace flexibility in the areas of recruitment, workplace accommodations, and training, and other workplace accommodations. And most of them were doing this. 21% weren't sure if their companies were taking any actions towards developing a workplace flexibility policy, and this was pretty significant. 20% of companies don't know if they have workplace flexibility policies, which means employees may not know, and those employees may not be benefiting from them. And if they're not being communicated broadly within the company, maybe they're not being reported. Maybe that's why they weren't being reported in the survey. So a few more of the survey findings that would be useful to employers include taking a look at some of the types of flexible work arrangements that members were using for their employees. And it includes flex time, telework, job sharing, job carving, and negotiated job descriptions. Flex time and telework were the most common responses from the survey members. 100% of them were using flex time and telework policies. And it makes a lot of sense that flex time and telework is number one. And we think about our own work experiences. And, if you've ever needed to change or arrange your work schedule to fit your life, we are easily able to do that oftentimes. And changing technology today has made teleworking something that's very easy to do. Another thing we learned was that employers aren't really utilizing negotiated job descriptions with employees. And we're going to talk a bit more about negotiated job descriptions later because it is really an important and valuable strategy. But only 8.3 of the survey members were using negotiated job descriptions as a workplace flexibility arrangement. And maybe, from the research, maybe this is one area where we can focus on educating employers and employees about this a bit more to utilize it in a more useful way. And then finally, most companies reported that they actually did have some staff that were trained in accommodations, and that's really great.
So what we've looked at is research that would be useful to employers that distills options and informs employers of effective approaches. So the return to work programs that we focused on are retention strategies to retain valued employees and to focus on an array of retention strategies that would enhance productivity of the workforce. Return to work programs that we looked at were designed to return a worker who is injured, disabled, or temporarily impaired to the workplace as soon as was medically feasible, often involved a progressive return to full duty. Most return to work programs were part of an overall disability management strategy. We found that some were managed in-house and others through third-party vendors. The in-depth study that we did, most was through third-party vendors, and you'll hear about that in a moment, and that they may include temporary or permanent accommodations. And those accommodations might include modified schedules, modified job duties, modified methods for completing job duties, transitional work, reassignment to an alternative position, and so on. We provided a link here that highlights resources from the Job Accommodation Network on return to work programs, which is part of their accommodation and compliance series, which we thought was very useful in terms of what they've learned from employers and their work. Another important body of research involves workplace flexibility. Workplace flexibility also was a basic business strategy with proven positive impact on turnover and employee productivity. And descriptions of and examples of workplace flexibility typically focus on time, place, or task. So flexibility in terms of when people work, where they work, and what it is that they do. We wanted to note that on the Office of Disability Employment Policies website, they have a section on workplace flexibility. Again, we've provided the link, which includes a 3-page paper on workforce flexibility as a strategic business approach for an inclusive workforce at a workplace, and includes links to a toolkit with information for employees, employers, policymakers, and researchers, and also includes sections on those 3 pillars of workplace flexibility that I mentioned, time, place, and task, with links to dozens of resources, each including fact sheets, case studies, and more. And we think as a strategy that separating the resources for these different target audiences, really has a lot of wisdom, so that, that people can then look at this from a number of different perspectives, not only their own, but through the eyes of employees, employers, policymakers, and researchers. So we, again, think that it's a very useful resource on the research. Brittany mentioned the USBLN survey and the very low numbers, only 8.3% reported using negotiated job descriptions. And negotiated job descriptions are kind of a hallmark of customized employment as another retention and return to work strategy. So customized employment is a universal strategy designed to personalize the employment relationship between an employer and an employee to meet the needs of both. And it creates an individualized match between the strengths, conditions, and interests to the job candidate or employee and the identified business needs of employer, so that it's a win-win for both. And if you think about it, if you've been in your job any length of time, chances are you have a customized job description that over time you start doing more of the things that you're good at and that are your best contribution, and are able to assign other things to other people. A customized job description is typically created based on either task reassignment, where some of the current tasks of a worker are reassigned to a new employee, and that task reassignment typically takes the form of the creation of another job that's negotiated, again, based on a current workplace need, as well as what the individual brings to the workplace. And I talked before about strengths, conditions, and interests. When we talk about conditions, it may be that someone really needs a job where they're not on their feet all the time, or where they're in a more quiet environment, or where they can access the services of a job coach through their handheld phone, where they can interact with someone through FaceTime or get prompts to remind them to move on to the next task. So conditions could be any one of a number of things. Customized job descriptions also could be job carving, where there's an existing job description that's modified and doesn't have all of the tasks from the original one, or job sharing, where 2 or more people share the tasks and responsibilities of a job based on each other's strengths. And again, there are great resources. The LEAD Center is doing some pilot projects in American Job Centers in a couple of states to see the best ways to introduce customized employment on a larger scale within workplaces and within the workforce system. So we hope to have research about that shortly. And now Brittany is going to talk some about the in-depth study we did on a single corporation.
Thanks, Rebecca. So last year we visited a large U.S. corporation, and they chose not to be identified by name, so I won't be identifying them by name. But it was a company that really demonstrated some great best practices in employee retention and return to work. They also demonstrate very high retention and low turnover rates. In fact, they have a 6% turnover rate after the first year of employment and an average tenure of 10 years of employment. And it's a retail industry, which if any of you have ever experienced retail industry, it's a very high turnover industry. So this is pretty significant, and we wanted to look at it a bit further. This large multi-site corporation was selected to ensure that the workplace would be diverse. So they have facilities in urban, rural, and suburban settings. So that was a really broad slice of what we got to look at through this corporation. We studied their best practices to learn more about and document some of the effective retention and return to work policies and practices. And to do that, we focused on their workplace culture. We focused on the workforce itself, on benefits, and then on other programs that they provided. And in the best practices and employer retention and return to work report, which as Rebecca mentioned will be released later this year, we describe the corporation's practices and strategies at the individual, workplace, and systems level that benefit both the employer and the employee. The report also provides insight into some employer challenges and the solutions currently in place to address those challenges. So as we know, for any corporation, as Rebecca mentioned this as well, the ability to attract, train, and then most importantly retain highly qualified employees is mission critical to businesses and to their financial status and then to the success of their operations. And this corporation clearly realized that its success depends to a very significant degree on the continued contributions of their employees, including members of senior management and other key operations, and that the loss of any employee from the senior management to the administrative personnel to their boots on the ground within their facilities, that the loss of any of these employees would really have an adverse effect on the corporation. And they invest significant resources in training and motivating their employees to stay, and they wanted their retention strategies to also reflect that same business model. So how did they do this? The research that we did described some of the structures within the corporation to build and support an effective retention and return to work policy. This corporation structure consistently communicated a corporate culture that values employees and demonstrated that it was consistent across the facilities and within the corporate headquarters. This corporate culture includes a high value on its workforce. Employees are actually treated as customers. They're acknowledged as important company assets, and there's a continued commitment to providing a living wage, excellent benefits, career opportunities for upward mobility, and then really seamless income protection if an injury or an illness would preclude the employee from working. And during the research that we did, I consistently heard from employees and from all ranks of all statuses of the management to employer level that the employees really, simply put, it was the right thing to take care of employees. It was the right thing to do. the corporation created an integrated and collaborative service mechanism within both the corporation and through their vendors to support the workforce and communicated strategies that supported retention and return to work. So their focus was really on providing the right benefits under the right plan and at the right time. And to do this, the corporation really needed to integrate not only internally but externally. And internally, they integrated their workers' compensation programs, their other leave departments into one cohesive unit. And then they also connected their external network of vendors to create really this very, very highly structured integrated leave department across internal and external sources. So this allowed for really seamless response to an employee, so they're not being bounced around from department to department and vendor to vendor, which I'm sure we can all relate is somewhat frustrating when we're in those types of situations, and particularly frustrating for an employee that's trying to recover and get back to work. And really this conveys that the message is, it doesn't matter if you were hurt on the job, it doesn't matter if you got sick or if you got a disability. The focus became, let's get our employee back to work. And the training and support for supervisors to help do this was really also key to what this corporation is doing. They have policies and systems in place to ensure that there's constant communication, positive messages with employees who experience disability, injuries, or illnesses, and so that they receive that needed support in a timely manner and know to the extent that they're valued. Again, that value is really, really important to the corporation. So we've gone through sort of what we looked at and what the company is doing well. Here's some other promising practices that are currently being used within the corporation. They've developed a disability management program that creates linkages to ensure that the services are integrated, personalized, and that vendors are collaborating together, and I've mentioned this before. These programs include disability-related programs like worker compensation programs, short and long-term disability, employee assistant programs, disease management programs, wellness, healthcare, rehabilitation programs, and other medical and clinical support services. So they've built this really wide range of services available to employees and have integrated them all together. So not only are they working with their vendors very closely, they've developed collaborations between the vendors and the managers on stay at work, return to work, and then some of the traditional return to work and prevention programs. And finally, they worked really hard to establish business agreements between the employee assistance programs, workers' compensation carriers, healthcare plans, short and long-term disability carriers, disability management providers, and the wellness providers. And these aren't optional. They're required agreements for the business to conduct work with outside vendors. And the vendors are actually now working with each other in a much more collaborative way, and Rebecca is going to talk a little bit more about that vendor integration and support.
So from a research perspective, we tried to capture not only what the practices were, but what the implementation strategies are, because very often practices can't be transplanted. So the fact that they were doing things that other companies might do wasn't our only focus, but how was it that they were kind of shepherding implementation to make sure that there was a knowledge transfer, that it worked in all of their sites. So each year, one of their practices and one of their implementation strategies was that all vendors were invited to the corporation's headquarters for a 2-day summit in which presentations were made about their services and access points and processes. So it was an opportunity for vendors to familiarize themselves with the services available through other suppliers. And at first, these vendors viewed others as competitors and were uncomfortable with the concept of a summit, since some had competing services. However, the corporation has held these summits for 5 years, and each time resistance has lessened and collaborations have increased. So these are now collaborative efforts between, as Brittany said, the EAP, workers' comp programs, short and long-term disability, healthcare plans, providers of prevention and wellness services, case management providers, which made each provider aware of each other's resources and enabled them to make referrals when an employee needed assistance. It also enabled vendors to do outreach, send referrals, and alert other providers about an employee's possible need for their services, all focused on getting people back into the workforce and lessening the possibility of turnover. Vendors also were trained to actively listen and create linkages when needs surfaced, and all participate in monthly grand rounds to review individual situations and make case review calls. So they had a lot of support for implementation. We're going to just talk about one other practice that we thought was very promising and doesn't exist in many organizations, and that's that they continually review job descriptions. And as a universal practice, this one allows for ongoing customization of jobs. So these job analyses were available for every position and not only included physical and mental demands and working conditions, but essential and non-essential functions and the demands attached to many. And there are many organizations where there aren't job descriptions or where job descriptions never change. What people do may change, but the job descriptions don't. And having this review really, really supported, again, a retention and return to work and disability management strategy. As part of that, they did ergonomic analyses to determine any needs for modifications or accommodations to address safety training and specific job functions, ergonomic needs. Adjustments or equipment were addressed. Training was done on proper posture and safe lifting. And safety and injury prevention was a strong focus in this corporation, with each location having a safety committee. And as Brittany pointed out, communication of the corporate culture was one of their real strengths. And all of this communicated to employees that they were valued, that there were a lot of supports for them to be able to stay in the workforce. Other things that the LEAD Center does for knowledge translation include communities of practice. We are currently hosting one between Centers for Independent Living and American Job Centers to promote employment and economic advancement outcomes for the people that they potentially could jointly support, and we're creating those links, and we're about to launch an equal opportunity community practice to work in the American Job Centers and with their partners. We have a webinar series. We put out information via social media, and Brittany will provide some links at the end. And we do some demonstration projects on things like customized employment and financial capability, and work in partnership with our national and dissemination partners and through the Knowledge Translation Consortium. And I think we're kind of out of time. Do we have a minute to talk about the Knowledge Translation Consortium?
Yes, that's fine. We can.
Okay, we just one slide, really.
We'll go quickly. So 2 years ago, when we started the LEAD Center, we also started a Knowledge Translation Consortium, and this consortium brings together federally funded training and technical assistance center, and each has their own unique mission addressing different aspects of employment, career readiness, development, transition, and accessibility for youth and adults with disabilities. And the KT consortium, as we call it, the members come together to meet and interact, to share information on each center's focus, on their funding, on their use of knowledge translation tools, and also to develop a framework for sharing resources and training opportunities to collectively improve employment and economic advancement outcomes for individuals with disabilities. And something must be working, because that is how we are working with our partners here at KTER, and it's been a really great partnership to start, and it really was seated within this Knowledge Translation Consortium.
Maybe we can just go quickly through the, we don't need to.
Yeah, and we're going to just really quickly go through. These are the consortium members. There's quite a few of them. and they're all available on our website under leadcenter.org. So we encourage you to connect with the Lead Center. You can sign up for Lead Center News from the link here. We also encourage you to follow the Lead Center on Facebook, Twitter, LinkedIn. We have lots of YouTube videos. And we also encourage you to reach out to Rebecca and I. We have our contact information below there. And we really appreciate the opportunity to talk to you all today. So thank you.
Okay, well, thank you so much, Rebecca and Brittany. And we'll keep to a 10-minute break, so we will go on break and reconvene at 3:55 Eastern. Thank you. Okay, well, welcome back, everyone. We're looking forward to a really great conversation. In fact, some of it we've been talking a little bit offline, and I think it's going to be a great panel. The way that it's going to work is I will introduce our three panelists, and then each of them will have the floor, and then we'll have just a free-for-all, and you all can please do ask your questions in the chat, and we'll make sure that they get addressed. And actually, we're running a little bit late, so at 4:50 we will end this. We may sort of blend in my wrap-up into the discussion depending on how things go. At 4:50, John Westbrook will take over to close the conference as a whole. So without further ado, I'm going to start introducing our panelists. I'll give the bio for each of them, and then Mark will talk. So Mark Williams is with us. He's devoted his career to service and advocacy in the region's nonprofit sector. He's held a variety of positions to increase the participation of people with disabilities in housing, in education, health, and employment. I knew about him because I knew he was the former director of Disability Works, and that's how he got involved in the KTER Center work. While he was there, he led a staff of 12 disability resource coordinators throughout the state of Illinois, and they provided technical assistance and education on disability inclusion to workforce professionals in the state's public workforce development centers. Currently, Mark works with the Ability Links program of Marion Joy Rehabilitation Center, and he identifies and develops content and resources to help job seekers and employers remove barriers to disability inclusion in the workplace. Mark is also director of the Chicagoland Business Leadership Network, which is an affiliate of the previously mentioned U.S. Business Leadership Network. This is a national business-led organization that helps business drive performance by leveraging disability inclusion in the workplace, supply chain, and marketplace. In addition, as an individual with a low vision disability throughout his life, Mark has personally confronted workplace and social barriers related to disability. After we hear from Mark, Arun Kapoor is going to talk. Dr. Kapoor specializes in disability and rehabilitation research utilizing existing large databases. He also studies health and health disparities among people with disabilities. Currently, he is research faculty at the Employment and Disability Institute in the School of Industrial and Labor Relations at Cornell University in New York. In that role, he has several hats. He's the research director and co-principal investigator for the New York State PROMISE. PROMISE stands for Promoting Readiness of Minors in Supplemental Security Income, which is a randomized controlled trial designed to evaluate the impact of evidence-based practices in supporting transition to work and post-secondary education for youth with disabilities who receive supplemental security income, usually known as SSI. He is also the PI of international rehabilitation research studies that focus on including people with disabilities into livelihood programs in developing countries. Dr. Kapoor and colleagues led a scoping review of literature summarizing the existing evidence on employer practices for employment of people with disabilities. So he is here to lend his research expertise to our panel discussion. And finally, from the corporate world, we have Ann Miono. She works in field operations at Microsoft as Senior Group Manager, Communications and Training. In this role, she is responsible for ensuring that the company's global sales team understands all elements of Microsoft's incentive compensation program. Before moving to field operations, Ann worked in executive communications, and prior to joining Microsoft, served in a variety of communication roles at Dell and Texas Instruments. Ann has an interesting background both in business and in writing. She was a Michener Fellow at UT's University of Texas at Austin's Masters of Fine Arts program, and she holds an MBA and has been a speechwriter for Stephen Dell. Okay, so that's who's with us today. And Mark, I'm going to give you the floor. I know you have a lot to say.
Well, thank you, Kathleen. I'll try to say it quickly. We have 4 questions that I've been asked to address. I'm going to give short 10-second answers to each of them, and then I think I'm going to just present some information that will address more than one of these questions, perhaps some overlap. So that way, hopefully, we can be discreet and general. And of course, if there are questions or issues that guests may want to address, they're free to do that. The first question was, under what circumstances might business use currently available research? And I categorize that into 3 categories. And working with companies through our Business Leader Network affiliate across the spectrum, I think the categories that their issues fall into have to do with compliance, culture, and safety. Compliance in that companies want to ensure that they are complying with the law, especially now with the new 503 regulations coming out of the Office of Federal Contract Compliance. Companies want to know, number one, that they're following the new regulations if they're government contractors, but more than that, because the new regulations address various, what I would call cultural aspects of disability inclusion, they want to know how to achieve goals that have been traditionally beyond their reach. The second category, having to do with culture, simply reflects companies asking the service providing and disability community, how do we get there? You know, on a day-to-day basis, we don't have many applicants with disabilities. We hire people with disabilities, but we find it hard to include them in the daily culture of our organization. How do we remain sensitive to disability beyond just hiring? And that's a big issue. You know, and as I told my colleagues before the presentation, I'm not a researcher, so I don't know how to address that. But to the extent that quantitative or qualitative research could, I think it's a vital issue. I know that the research continues to show that attitudes and culture are the very most significant factors that impede the participation of people with disabilities in corporate culture. And the third issue has to do with safety. And to that end, I shared an article with Kathleen about the Walgreens Center Distribution Center. Walgreens, a number of years ago, built a network of distribution centers that are universally designed to be accessible to both people with disabilities and people without disabilities. The safety of this is reflected in a recent magazine article, which I think has been made available to you, which compares the statistics on issues of safety with other distribution centers, and within the center between the disabled employees and employees without disabilities. And clearly, the results show that a universally designed center, which is inclusive of both people with disabilities and without disabilities, is more productive and safer than prior centers. So other companies have tried to follow this model, but clearly the research that went into the safety management article, was evidence-based and points to clear improvements, not only for people with disabilities, but for the entire workplace culture. I have a visual disability. When I go into a restaurant, I can't read the menu on the wall. I constantly tell myself, if that was easier to read for me, it would be easier to read for everybody. In terms of employing people with disabilities, what research would be most influential to employers? My answer to that is it depends. Because companies exist across a spectrum of industries, size, and the types of work they focus on, it really is hard to find research themes, I suspect, that can be applied across this broad spectrum. The issues that companies bring to the table are so specific that they almost require independent research of their own. And so for that matter, I say it depends. I think the more that a company leaves the home base of compliance and tries to move into the more cultural aspects of disability inclusion and the integration of disability inclusion with diversity, the issues become more complex and they're harder to address with broad research topics. Number 3, how can researchers and employers work more collaboratively to increase the employment rate of people with disabilities? I think the more specific the research here, the better. Work with companies who can commission research projects to meet their own needs. will, I think, get the sorts of results that they need. Finally, do you have other thoughts about how researchers, including disability and rehabilitation researchers, can work more collaboratively? I would say to look carefully at the connections with service providers and also with the K through 12 schools and higher education. The barriers here are that business community will say in many cases the service providing community can't give us the work-ready clients we need. In the K through 12 school, at least in the public school sector, IEPs, individualized education programs, and transition planning are woefully behind the standards set for career preparation through the Individuals with Disabilities Education Act, and that's across every state in the union. So the idea, while research has already proven that career exposure and self-advocacy skills at a young age for students beginning in elementary school will help to ensure their career success, these are observations that still have to be put into practice in every school. And of course, in higher ed, companies tell me that there's a big disconnect between student services on disability and career services. That means that while students can have the benefit of disability services on campus, chances are their career services office knows very little about including disability into the diversity conversation. So if there's a way to translate these needs into research projects that are of benefit, that can strengthen these relationships and provide the support that people with disability needs across their life cycles to be successful in their careers, then those are the projects that organizations like KTER may want to consider. In a general sense, I've mentioned the 503 regulations, but just to recap a couple of the most important requirements, the self-disclosure process, organizations are very interested in encouraging self-disclosure. I encourage, and I think others will encourage employees to disclose if they need an accommodation. And that's simply because disability is still a stigmatizing condition. But to the extent that stigma can be reduced, and I know that this is a cultural issue, and self-disclosure can increase, companies, federal contractors will be able to comply with new regulations more fully. A number of regulations in the 503 world are also focused on data collection. Research topics focusing on data collection, making it more efficient because data collection is a cost. I imagine would be welcomed by the business community. I also wanted to bring to your attention what I think is a cutting-edge piece from Deloitte called Uncovering Talent. I think this has been made available to you, and I think it reflects what the knowledge-based companies like Deloitte are currently trying to address to increase disability inclusion. Their observation is based on Irving Goffman's work on how individuals with stigmatized identities expend energy to hide or minimize their identity to appearance, affiliation, advocacy, and association. The goal in uncovering is to remove that compulsion to hide a person's disability and refocus an employee's energy on what's needed to be productive. There are a number of findings in the report that I shared with Kathleen, and to me, they're truly revealing. And I think they also underscore a very forward-thinking perspective on Deloitte's part to seek authenticity as a driver for a diverse culture that includes disability. I've already mentioned the safety management article, Creating an Inclusive Workplace, at the Walgreens Distribution Center, so that will be available. And I also wanted to mention the USBLN Disability Employment Index, which is a tool for companies to gauge their own success efforts and focus on inclusiveness. The USBLN also publishes, without charge, best practices for employment, which again takes a fairly comprehensive approach in terms of becoming inclusive, not just in hiring, but across all of the different functions in the organization, modern organizations that they have. And they also have a self-compliance tool to help companies ensure that they're in line with the new 503 regulations. Another handout that I shared with Kathleen, the final one, includes a report from the National Organization on Disability from a presentation they give to the U.S. Department of Labor in July 2014 in terms of what realistic targets are and the sorts of questions that employers ask. Just to give you an idea and to invite you to consider how these questions might be translated into research. Questions like, how do we do this company-wide? How do we create inclusive cultures? We need help navigating the service provider system. It would be nice to be able to work with one organization that would manage this for us. How do we deal with the fear factor among our managers and coworkers? And surprisingly, well, not surprisingly to some of us, but less than 1/3 of companies track employment with disabilities hiring. Disability also lags behind diversity policy. CEOs promote diversity, but not disability inclusion generally. Fewer employee resource groups target disability, and less than 50% of recruiters are trained on disability employment. I've already mentioned that student and disability services at in the higher education community are a big issue. If they could connect and the disability services could also provide career support, or these two partners even better could work together to create an integrated setting, I think job seekers with professional qualifications would be more successful in linking to the companies who are actively looking for. And of course, as I've already mentioned, self-advocacy and career exposure in the K-12 school system are integral. And to the extent that companies can participate in these mentoring and job shadowing programs, and to the extent that research institutions like KTER can come up with evidence-based practices that make these programs successful, I think we would be headed in the right direction. So that kind of concludes what I had prepared to say. I hope that answers the questions, and would be glad to answer additional ones. Thank you.
Great. Well, thanks so much, Mark. That was a really comprehensive answer to all these questions, and we appreciate your perspective and your role as, you know, kind of a foot in both worlds of both business and the disability community. So we're going to shift gears a little bit and turn to Dr. Kapoor, who will be addressing the same 4 questions, but as we all know from having heard about his vast experience in research and focusing on that expertise. Dr. Kapoor?
Well, thank you so much. Before I begin, I do want to thank everybody for this opportunity to be talking to our colleague researchers, academicians, practitioners, and policymakers. It's always a pleasure to be in conversations with all of you. And I do also want to acknowledge that the 4 questions that are posed to us are pretty challenging and thought-provoking. At the same time, some are above my pay grade as well. So I will try to do as much justice as possible from the perspective of research to respond to this. I do want to mention that some of what I will be sharing will be based on our most recent research that we have conducted in the area of scoping reviews of literature that addresses employer practices, which we are looking at publishing into a special issue of a journal called Rehabilitation Research, Policy and Education. And some of the responses are my own personal observations. So those are the first introductory remarks I wanted to make prior to getting into the depth of my my perspective. Now, I may also want to digress from the structure of the 4 questions and provide you a bit of a research perspective as to, you know, where we are in terms of the employer practices research. So this is a collation work that we did here at Cornell under our Employer Practices Rehabilitation Research and Training Center funded through NIDER. And in here, what we tried doing is we looked at the entire set of research published after the implementation of ADA through the year 2010 and wanted to identify based on the existing knowledge as to what percentage of research is actually directed to employers, though that covers employer practices. So we started looking at all the research that was published in that period and identified that there were about only 245 articles that have been published overall over the period of about 20 years, where we could find articles that were addressing employer practices. And among those 245 articles, about a third of them, only one-third of 245, were directly addressing employers or HR personnel. Again, among the employer practices research, more than half were addressing the VR practitioners, the community-based organizations and service providers. So essentially there is an issue of targeting in terms of where the information is actually being directed and how the information reaches employers. So at least in that sense, we have, as a research community, we do have our work cut out in kind of identifying questions and approaches that directly targets research to employers and HR professionals. That is one topic I wanted to share. Another tidbit that I do want to share is in context of the presentation that we heard regarding return to work. Again, when we looked at the number of articles that were published across these different areas of employment process, which included hiring, culture, and organization culture, climate attitudes, accommodation, returns and advancement, disability management, return to work. We had discipline, dispute resolution, termination. Across all of these areas, the maximum number of articles have been published around accommodation, organization culture, climate attitudes. There are more than 50% published in the area of recruitment and hiring. However, again, the numbers start dwindling down when we go across the categories. There are about 17% of articles that are focusing on disability management and return to work, and about 13% and a little lesser in the area of discipline, dispute resolution, and termination. And when I make these comments, please also note that we had a different way of distilling through the literature. So there might be articles regarding, for example, return to work published that are targeting employees' perspective or the service provider's perspective of how the return to work actually improved the overall process of return to an integration of persons with disability back into their work environment. But our focus was from the employer perspective, what were the research that were published. So in that sense, again, the targeting of the literature also matters when we look at these numbers. But I'm coming back to my point in saying, okay, so first of all, under what circumstances might business use currently available research to make decisions? To respond to that, I think we have a lot of work that we need to do in the area of targeting appropriate research and materials towards the use of businesses and HR professionals. And I think that's the first step we need to be able to do. And we need to be able to also publish. Again, I'm talking to our fellow researchers and esteemed colleagues online, is to look at publishing into journals as well as the magazines or some of these outlets where the employers and HR professionals go to as for that information. And I speak from my own perspective as I look at this is if I was thinking about reaching out to employers, I think one thing that we may have to look into is increasing our repertoire beyond research writing to writing for businesses, which is very different than the research writing, so that we make products more consumable and available. One of the approaches that one of our Northeast area center house-based here at Cornell has used is trying to convert the research contents into tidbits of information that are immediately available on the fly that would help respond to a concern the HR manager may have, saying that, okay, I'm getting into an interview. We have an applicant who has a disability. Now, how might I be able to ensure that we are providing necessary accommodation and also following through the required process? And so we are working, or rather the team is working on just-in-time toolkits that are made available. So those are some examples of innovation that could help assist with reaching the information out to the business community and improving their uptake of the information that we already know. But more importantly, I think the first and foremost work that needs to be done is to kind of target research towards the employers and keeping an employer context in its sense. And I think I also do want to give credit to our funding agency, NIDER, and others, including Department of Labor and U.S. Office of Disability Employment and Policy, where they have started an impetus around the demand-side strategies in improving approaches to help address the demand-side issues in improving employment outcomes for people with disabilities. In terms of the next question, what research would be most influential to employers? Again, here the format and the targeting of research is very important, as well as the design. As I said, it's something that the JIT approaches might help inform, and there might be other approaches in the field of HR education that needs to be considered, and the adult learning environment that needs to be considered as well. How researchers and employers work more collaboratively to increase employment rates. I think first and foremost, again, I go back to myself thinking about that we have to expand our capabilities in working with employers and deeply understanding what are some of the employers' concerns about and beyond the regulatory aspects of employing persons with disabilities. How best might we work collaboratively to establish an evidence that creates a compelling conversation around employing people with disabilities as a diversity initiative, as an initiative where employers find that as beneficial for them and makes a business sense. Again, the Office of Disability Employment and Policy has put together several business cases, and I think we should contribute to continue developing some of those and work with employers closely in providing them metrics on ROIs, how I could improve my returns on investment if I have a workplace wellness program, if I have a return to work program. And again, going back to our previous comment here, sense that all of this knowledge is very much situated. That means it is so contextualized. So at some point, we do want to be also thinking about how can we work with employers in increasing their capabilities of being able to create this situated knowledge. So providing employers a situated learning experience and exposing them to the process of conducting a systematic inquiry will enable them in creating a situated knowledge that is appropriate to their contextual needs and environments. At the same time, from a research perspective, I think we have addressed some of these things in a very cursory manner by surveying and doing something that is that has not been of that much of a high rigor. I think it's important to have an ecological multi-level framework that also considers a person in a context and the context in a broader environment. I think that kind of a multi-level approach will help improve not only the understanding of how a particular strategy or policy can impact overall employment outcomes for people with disabilities, but also help improve its adaptability and in the research world, what we call the external validity. That means that a principle applied in one place can be valid in another place. And then we can, based on what we study, can say these are the chances that this would be succeeding in some other context as well. So I think a multi-level approach and introducing more rigor in terms of studying some of these strategies will help improve establishing the evidence base, but at the same time communicating this to employers as well, that this is something of their interest. Another thing I do want to also comment on, it's not about also that researchers have to be directly working with employers all the time. There is another layer of service systems that needs to be addressed as well, where they need some hand-holding. For example, the workforce development agencies that are working constantly with employers. I think this is where the researchers have also a role cut out in terms of improving their abilities and bringing their resource tools on par with the more contemporary business environments and resourcing them with the information in a timely manner so that they have tools necessary to work closely with employers and have ability to network with employers and understand the process of employment and the market process that exists in the current labor market conditions. I think so those are some of the roles that researchers can play to improve employment outcomes. Now, coming to the last point, do you have other thoughts about how researchers can work more collaboratively with businesses? One thing I think it's important as researchers, we should be thinking about doing research in the context and not decontextualize ourselves. That's the first and foremost important thing. The next thing is also building collaborative relationship with the businesses is an important area. But at the same time, keeping a track and understanding of how the labor market in general is evolving post-recession or in any other special times so that we can continually think about ways of expanding capabilities, not only for people with disabilities, but also for their employers to be able to absorb the human resource that exists in the country and be able to utilize that capital in being able to make more of their investment. So those are some of my thoughts that I was able to collect while I went through the sets of the presentation today. Thank you very much.
Thank you so much, Dr. Kapoor. We'll now hear from Ann Miano from Microsoft.
Thank you. And it is right that I should go after Dr. Kapoor, who emphasized over and over about understanding businesses and the audience that you want to engage with and what we're thinking about. So I come to this panel discussion from the perspective I want to offer you is think of me as somebody who represents a very, very large corporation. So that's the particular perspective that I have. And also as an employer, I hire people. And my company supports me in that process. And it's very important. And so I'll talk a little bit about what I'm looking for from my company to help me in the hiring process. It's just good to know because that's a way to support corporations with your research is how can you help managers like myself who are doing hiring regularly. In some ways, Microsoft is like many large tech corporations. And so the things that I will talk about apply to many different companies, and in some ways Microsoft is special. And fortunately or unfortunately, I think Microsoft is a real leader in the area of in diversity, and especially looking at diversity in a broad way, that it does also include people with disabilities and how to engage them in a way that improves both the community, our company, and our customers' experiences across the board. So, the questions. The first question, under what circumstances might businesses use research to make decisions? A company like Microsoft, a very large tech company, there are many opportunities, I think, for researchers to engage with us and demonstrate to us the value of the work that you do. I'll give you some specific examples about Microsoft. The opportunity to engage with us, like I said, similar in tech companies, is at many different levels. So there is the community affairs space, and I'll talk about an event there. There's also at the HR level, and then there's also at the product development level. So in the community engagement space, Microsoft, for example, has for the last 4 years has hosted something called the Ability Summit. And that summit is all about how do we offer people with disabilities the opportunity to make a big impact in the corporate space. And we talk about a variety of things at this summit. We talk about hiring. We also talk about giving power to people with disabilities so they could do any job that they wanted, not necessarily with Microsoft. And we talk about how that impacts our technology development. For technology companies, diversity is really, really important because we learn. we have such a huge push to bring in people with different perspectives into our company, because the things that we learn in developing technologies for specific audiences, we can then take to our broader markets. So for example, voice-enabled technologies or gesture-enabled technologies. These are things that we have developed for specific customer groups with specific needs that we've then gone on to integrate into broader products. So this issue is really, really important to us. How do we engage? So we do have this incredible thing called the Ability Summit, and I imagine that we're not alone, that there are other companies like us who host these amazing events. Great opportunity to engage, great opportunity to have a stage to present your research, because the audience is looking for it. We also have employee groups. Again, I think this is true of big companies like Microsoft that really value engaging people with diverse backgrounds and skills. We have a group that is called, let me see, I wrote it down so I could tell you exactly what it's called because it's kind of interesting. We have a cross-disability employee resource group. This is an employee group. It's certainly supported by our HR team, but these are the people that host the Ability Summit. And the Ability Summit isn't just a Microsoft event. It brings in people from all over the world, actually. It's quite an event. So there's an opportunity to engage at the employee level. We have very sophisticated employee groups who are thinking about these things. And then in HR, we have a really great diversity group that is looking at all different ways that we engage with people who bring different perspectives to the company. So my message is there are many, many different places where you can plug into companies where they would be interested in the research that you're doing, and it could make a difference. And there are also forums for you to showcase the work that you're doing and reach a pretty broad audience. In terms of employing people with disabilities. So companies like to see evidence that there's benefit. So organizations like Mark's are really powerful because it's an opportunity for companies to share stories. And so what kinds of stories do we want to hear? Well, I'm with a technology company. We're fascinated with how bringing in diverse people, people with diverse backgrounds, translates into innovation. That's the kind of stories that we love. So we have people who come into our company with who have disabilities. Because of their interest, they engage in community groups. They create projects within Microsoft technology, little skunkworks projects that then turn into products that we can take to the market. So for example, we have an employee who is blind, who works in the UK. He has an interest with an organization that helps people with disabilities related to sight become more independent. And he, just working with this organization and getting some of his friends in Microsoft to develop technologies, this has turned into a new business. Because these technologies that can help people become more independent, it's primarily enabling people to be able to move around the city independently with GPS technology that's voice enabled and speaks to them. And those kinds of stories, I think, are very, very powerful for companies. I mean, we do invest in our diverse employee population because it's the right thing to do, but we also invest in it because we truly believe that it will help us on the innovation front and will help us serve our customers better. So that's very powerful evidence. On the third question, how can researchers and employers work more collaboratively? Microsoft, like I said, has groups really within our company, both employee groups and within HR, absolutely committed to promoting diversity within our company and learning from people with disabilities and enhancing our customer experience through those perspectives. So I think that it's powerful to be reaching out not just to our, our institutional groups like HR, and it is powerful to reach out to them, but to find out about the employee groups that are at Microsoft, because they're doing amazing work and they are influential within Microsoft. And again, this is true of other big companies that have these employee groups. So I guess my tip is, don't just think about community affairs and HR, although they are very, very important. Think about the employee groups as well that have influence and are shaping the corporate policy. As I said, it's an employee group that founded the Ability Summit, and it's an employee group that has turned that into quite an event. And finally, do I have thoughts about how researchers can work more collaboratively with business? So I just wanted to be sure that I talked a little bit about me as a manager and as a hiring person. I rely quite a bit on my HR organization to help me and to help me see candidates. And I think that's something to think about, is how can you help my HR team help me? Hiring is a really time-consuming, labor-intensive process. It takes me a long time to hire people for my team. I need to get through a lot of data, basically. I need to do a lot of interviews, and I'm not alone, with other managers that find it to be a very difficult process. And so a group that you might want to think about too is the recruiting team within HR, and how to think about how can you enable them to help me? How can you make it easier for me to find candidates? How can you make it easier for me to think differently about how diverse candidates with disabilities can contribute to what I'm trying to achieve at Microsoft? So that's what I have for you. Happy to answer any questions.
Great. Well, thank you, Anne. Since Anne just spoke, Mark or Dr. Kapoor, do you have any questions for Anne?
I don't have any questions, but if I could just say that here in Chicago, Microsoft hosts our Illinois Technology or Information Technology Knowledge Access Network, and they've been very generous in sharing some of their latest development platforms with job seekers with disabilities who are all in the development field. We meet there twice a week, and they've shared some of their inside, look at the future applications which have been just overwhelming. And I just want to, give you kind of a pat on the back for the outreach that Microsoft, at least here in Chicago, has sustained with the disability community through this network.
I'm glad that we're showing up there as well. I mean, the state of Washington is very active in this front. I don't know if anybody is familiar with some of the things the state of Washington is doing, and that's where Microsoft is located. Our Governor Jay Inslee has a committee on disability issues and employment, and his team has a very close relationship with Microsoft as well. So as a company, we care, but we also our headquarters are in a location of people who care. This is an important issue for those of us who live in the state of Washington.
Hi, this is Arun. I have a question for Anne. First of all, thank you for those great reflective comments on how Microsoft is contributing to improving employment outcomes for people with disabilities. I think it's amazing to see the amount of work you're able to accomplish. But my question is, at some point, again, I'm talking as a selfish researcher here. So, and I acknowledge it's selfish. But my question is, sometimes it's a perception that most of us would probably know what we are doing. And I think it's a little too naive to assume that all of us have complete understanding of everything. is there any guidance that you might want to give out to your colleagues in the business as to how they might want to think about collaborating and hand-holding the researchers? Because we are trained and come from a particular perspective on evidence, but at the same time, we also need hand-holding and understanding as to what are some of the issues that are important and how best we might be able to partner with the businesses. So are there any guidance that you might have or some wisdom that you want to share?
That's a good question. Well, you know, in my world, the word that gets used a lot is impact. It's impact, impact, impact. And and as I said, the impact that we're looking for, the reason why we are so committed to having a diverse workforce is around innovation. How does it make us a much more innovative company? And so being able to connect researchers in this area, being able to connect hiring and retaining employees with disabilities, how that changes a company environment and creates greater innovation. For a technology company, that's the word we want. There may be other companies that want the word productive. For us, it's innovative. That's very powerful. I mean, and I think it helps, again, it's help our people help us. So, you know, our HR team is fighting every day to make the argument about the things they do that are good for business. So, you know, we may all know intuitively, yeah, you know, a diverse population stimulates innovation. It stimulates more active conversations. It creates really productive tensions. But research that you do that can connect hiring people with disabilities to creating a more innovative environment, that's very, very powerful. So it's getting to our business impact, I think is what you want to think about. It's not stopping with, well, here's how you can retain employees with disabilities. We really care about retention, but then what's the benefit? What's the business impact when we do that? How does that make us more innovative? And another thing that's really important to think about is how things you do for one group translate into benefits for other. So you go back to the example of retaining people with disabilities. If we can show that retaining people with disabilities, the things that you do to retain employees with disabilities can also translate into retaining all employees, that's also very powerful research. So we saw that companies who did this for people who had mobility issues, wow, when they did that, it also delivered benefits to other parts of their population. So it had all these unexpected and much broader impacts. That's the kind of stuff that companies are really interested in. Did that help?
Yes, that did. Thank you very much.
Okay. And did anyone have questions for Mark Williams? I see someone is typing. Sandra Hamill. There was a question that came in prior to the event, and I guess any one of you might be able to speak to it depending on your experience, and it was whether you can talk about the role that community colleges might have in some of the kinds of collaborations that we've discussed that have potential. So have any of you worked in networks between business and community colleges?
Well, this is Mark, and I can tell you that here in the greater Chicagoland area, the community college network are very interested in workforce investment, and a number of colleges have been able to partner with different companies to develop specialized training programs to meet workforce needs. So I think there's a potential for community colleges to help address the disability factors in higher education. I don't know here, generally how specifically the community colleges are addressing disability issues as far as they connect with the career preparation issue. But I do know that, at least here in our region, they're playing an increasingly large role in workforce development.
And were there transition specialists involved in that initiative?
You know, the bottom line is I don't know. Generally, my own work on transition education is in the 9 through 12 high school arena, and it's really many steps behind the partnership end because it's focused on parent preparation and helping parents to act as advocates for their children. So, you know, to my knowledge, no, but I'm probably not the expert. There may be some very good examples of community colleges being able to play roles in strong transitioning programs. I'm just not aware of them.
Okay, because I know among a lot of members of our audience who are NIDER grantees, there's specific language in the Workforce Opportunity Investment Act that encourages attention to transition-age populations, so that's going to be a topic of increasing interest.
Right. I mean, my opinion is if IDEA, the Individuals with Disabilities Education Act, is funded at a higher level in the years to come, which a lot of people say it will be, is that there might be an increased emphasis, an increased resource for transitioning in education, in which case funding would be available for high schools and community colleges and parents, for that matter, to develop those components. So I think there's reason to hope.
Okay. And we do have a comment and a question from one of our participants, Sandra Hamill. She says, as we implement the Workforce Investment Opportunity Act, it sounds like it would be useful to have our employment coordinator or job developer staff find out what an employer's highest values are and connect hiring individuals with disabilities with impacting the employer's highest values. Any other tips from researchers on Workforce Investment Opportunity Act job-driven checklist implementation? So let's deal with the last part of that. Is anyone familiar with the job-driven checklist implementation?
No, this is Arun. I haven't come across the approaches around job-driven approach to vocational rehabilitation. However, I'm not certain or aware of the checklist that's out there.
Okay. Tendra and everybody online, I would encourage you to download what Mark Williams had us upload earlier this morning, and I believe that the NOD PDF, the National Organization on Disability, the report to the U.S. Department of Labor, discusses a number of initiatives that would be of interest, including some benchmarking and things that are not exactly. Oh, okay. Thanks. Sandra's posting the link to it, so that'll be a great resource also for people online to take a look at.
You know, and also let me just add that the USBLN now, I think they've released officially the Disability Employment Index, and you'll have to go to their website to look at the details of participating in that. But I know that is a benchmarking tool that has gotten a lot of work put into it, so it might be very, very good.
Absolutely.
Hi, and this is Rebecca Salon from the LEAD Center. I mean, a lot of the WIOA, the Workforce Innovation and Opportunity Act materials and regulations are just now being developed. The new Workforce Act was only passed in July, so that I think that a lot of the KT Consortium members and certainly the LEAD Center will be providing information on WIOA from a disability perspective. We have something that's going to be posted shortly, as well as action steps that people can take. But I think that you know, the message that from WIOA is that that the workforce system is looking for partners, and the workforce system is required to work with community colleges, with vocational rehabilitation, with the state DD and mental health agencies and Medicaid agencies that I think that as job developers are working, that they need to make themselves available and be part of shaping what the checklists might look like and what implementation might look like. But a lot of this is very formative at this point. So I encourage the person asking the question to just keep current and to give input as a lot of these regulations are being developed. I know that the Department of Labor and the Department of Education are both soliciting comments from the field, so it might be an opportunity to, to shape what this looks like going forward. Thanks.
Great. Thanks so much, Dr. Ceylon. Well, we are at time, so I think we will close this discussion, and I just wanted to thank our panelists as well as our presenters from the Lead Center. And please do keep in touch. We will be archiving this conference, so we'll send you all information about that. And I'm going to turn now to Dr. Westbrook, who will give us some final words.
Yes, thank you, Kathleen. And here we find ourselves at the end of our conference. First, I would like to thank all of those who participated. I hope you found this conference to be stimulating and has given you a few new ideas. I know it has for me. I also want to thank those that made presentations for your time, energy, and thoughtfulness in your presentations. This conference has been oriented to expanding your understanding related to planning and implementing knowledge translation activities that are aimed at increasing the employment of individuals with disabilities. We know that KT activities that are based in research evidence and are planned alongside with those who are the intended beneficiaries and those that are key implementers of the KT uptake process have the greatest likelihood for success. This is true no matter the nature of your KT outcome that may seek to produce changes in awareness, learning, attitudes, behaviors, policies, or even the environment as a whole. As we think to the future, it is worth noting that the research evidence addressing KT strategies, such as the use of champions that was discussed in the first day of our conference, is heavily based on healthcare interventions conducted in healthcare settings with healthcare professionals. While that's good, there is a need for more research in disability and rehabilitation settings for us to be confident of their effectiveness in our DNR world. As also noted in the conference earlier, the KT processes required for us to address high-quality employment outcomes for individuals with disabilities must necessarily be diverse and sensitive to the significant differences across the 4 target audiences that we have been focusing on in the last 2 days, including policymakers, vocational rehabilitation professionals, employers, and individuals with disabilities. So clearly, we have more KT-related research and work to do. Just to let you know, KTER staff will be emailing a brief evaluation to conference registrants to collect your comments and suggestions. We'd like to know what additional areas of information you'd like for us to focus on in the future. As you've heard, several of the research projects of the KTER Center are ongoing, so we will be bringing you culminating information about those. Additional training activities, including additional webcasts, will be forthcoming from the KTER Center. So please check our website. It has an easy web address, kter.org, to keep up with these offerings, and there you can subscribe to our free newsletter, which is named KTER Today. For NIDER and RSA grantees, we'd like to remind you that technical assistance is available from the KTER Center in the areas of knowledge translation, planning, and implementation, especially those related to promoting high-quality employment of individuals with disabilities. If you missed any portion of the conference, an archived version will be available through links you'll find at the website. It will probably take us a little while to get the archive ready, so feel free to drop us an email to ask about its status. As mentioned earlier, the work of the KTER Center is expected to continue into 2016, so please continue to contact us for information and assistance in areas related to knowledge translation of employment research. Again, we thank you very much for participating in our State of the Science Conference. We are now adjourned.